Did you know nearly 1 in 4 of all youth ages 13 to 18 have experienced a mental disorder with significant impact on their daily living? And half of all mental health disorders begin by age 14? Community Partnerships Prevention Resource Center provides training and prevention programming to identify the signs and symptoms of mental health challenges. These efforts can prevent the development of serious mental health disorders, saving lives across our community. Our Youth Mental Health Support Project works to reduce stigma surrounding youth mental health challenges while increasing the number of trusted adults who can help youth experiencing mental health crisis. We know collaboration is critical to the success of this project. With the help of many partners, including school staff, counselors, youth pastors, parents, and other community members, we're teaching people how to be trusted adults for youth in crisis and non-crisis situations. So far, more than 20 organizations have partnered with us to implement it.
I love mental health first aid primarily because it provides a research-based, evidence-based, workable model for people to become equipped to deal with the inevitable mental health issues and crises that they're going to come across. In particular, one of the messages I love about it is that it reduces stigma. There's an explicit anti-stigma message in it. I think it's important for Burrell Behavioral Health to partner in this mental health first aid movement because, well, our mission is to meet mental health needs where and when they occur and before they become more serious. And what better way to do that than to forearm and equip people with the skills they need.
Sadly, Lost and Found Grief Center ends up seeing families after a suicide or after something significant. I think any way that we can help our youth to be healthy, any way that we can help them to move forward in their lives in a positive direction, we need to do.
I attended a first aid course approximately 2 years ago and fell in love with the program. I thought it was fantastic and relevant. I was a classroom teacher at the time, so I would see kids struggling with some issues but didn't know how to reach them. I think it's important for the community to attend youth mental health first aid training because it really opens your eyes to struggles that youths are undergoing now where life has changed. It changes daily. Issues that we had growing up are not the same that kids have today. And I think a lot of adults need a refresher on what our youth's going through.
I attended the Youth Mental Health First Aid Training in December 2016. At the time, I was completing a social work practicum for my undergraduate with the juvenile justice system. It's really heightened my awareness of what emotions people are going through in different circumstances. One of the girls in our youth group was suicidal and she was actively trying to commit suicide at the time. And we assessed her over the phone and we were like, okay, we'll be there in 20 minutes. And we left the house and went and got her. Overall, she was so thankful for the experience. And even though it was a really terrible situation, we used it for the better and connected her to some resources in the community that she still uses, and she's doing so much better now.
Unaddressed mental health needs are connected to an increased risk for youth suicide. Locally, 16.6% of students in 6th to 12th grades reported that they were seriously considering suicide. 12% reported they had a plan of how they would die by suicide. Our Prevention Resource Center provides training, community events, and coalition efforts to reduce the number of youth seriously considering or attempting suicide. One of our prevention programs, Signs of Suicide, has been shown to reduce youth suicide attempts by up to 62%. One part teaches adult partners how to be trusted adults to youth who might be considering suicide. And the second part teaches students how to identify the signs of suicide in themselves and their peers, as well as how to care for those peers and tell a trusted adult about their concerns. We are only able to reduce the stigma and save lives because of our partners in the Signs of Suicide program.
Signs of Suicide is a best practice curriculum that's been researched, and the training for our staff is being provided by Community Partnership, which is a very valuable, not only financially, but just in terms of staff resources to help us, particularly with all of the issues that have occurred in recent years, not only in our district but nationwide, relating to mental health issues among youth, the suicide rates. So I think having the opportunity to partnership with CPO to offer these trainings has been a huge benefit to us. And I think the youth mental health training actually emphasizes how important it is to ask students directly what they're feeling and if they are thinking about killing themselves. And that's something that's very hard for adults to do and actually verbalize.
There's so much information out there now that kids are exposed to that we were never exposed to when I was a teenager. We have a tendency as adults to look at teenagers through the lens of our own experience of being a teenager, and it's so much different now. So by getting this information in schools and training teachers, administrators, parents, the signs to look for, that it's not just teenage moodiness, that it's not just hormones, and how to respond when they get that really scary answer back that maybe yes, they are thinking about suicide, they know how to respond to it. And we now have new resources with training, with SOS, that I think that really important for our coalition and other groups to be able to take advantage of. So community partnership with the Ozarks providing that assistance is really important in our community.
As you can see, community partnership is working to address needs and fill gaps in mental health promotion and suicide prevention. We are thankful for each partner and individual who works alongside us in these efforts. Together, we are building resilient children, healthy families, and strong communities through prevention efforts.